but we really encourage you to participate. In the upper right-hand corner of your screen, for most of you, you'll see a Q&A box. And please ask questions at any time. As your moderator, I'll be collecting and monitoring those questions, and then we'll have an opportunity at the end of the session to address your question. We have a remarkable panel with us today, and I really want to start by just inviting them, they know themselves better than I, to give us a bit of an introduction with just their name and their role, as well as their organization. Eugenia, we'll start with you.
Sure, thank you very much, Stephanie. My name is Eugenia Gibbons, and I'm the Boston Director of Climate Policy at Healthcare Without Harm.
Monica?
Monica Nicholsky. I'm the Director of Sustainability and Environmental Health at Blue Cross Blue Shield of Massachusetts, headquartered here in Boston, Mass. And in leading the environmental sustainability program, it's one of the many strategies we're launching in order to ensure population and public health. I'll get into it a little bit further as to how we're working with our division and department leaders to link these strategies to link these principles to our strategy and operations to ensure that we're having not only a positive environmental impact, but leading to positive health outcomes. Thank you for having me.
Great, thanks, Monica. Surili?
Hi, thank you. My name is Sootario Patel, and I'm with the American Public Health Association, where I direct the Center for Climate Health and Equity, but also I'm the Deputy Director for the Center for Public Health Policy, which is where our environmental health work sits. And I'm really pleased to be here. Thank you.
Awesome, 2 titles. And last but not least, Adam.
Hi, everyone. Yes, thank you again. It's great to be a part of this discussion. And my name is Adam Schlosser. I am a senior research scientist at MIT Center for Global Change Science. And I also serve as the Deputy Director for the MIT Joint Program on the Science and Policy of Global Change.
Great, thanks, Adam, and thanks to each of you for joining us. I really know this is going to be an engaging discussion. I just wanted to start by just emphasizing that I know for all of us, context really matters when you talk about and think about health, equity, and climate. As a registered nurse, I know myself, I ask that same question: how do the two link, and why does it matter? And so first, I'd like to give each of our panelists just an opportunity to give us a high-level overview of the work they do, and then why today's session matters not only to you, but to each of your organizations. And so I think we're going to start with Surili first.
Sure. So with the American Public Health Association, APHA, the discussion of climate change started about 100 years ago with our first publication in our journal for American Journal for Public Health, where a group of doctors got together and talked about climatology then, not climate change, as an issue that if we don't address, we'll certainly feel the effects on our health in 100 years. So I think that article was published in 1923. And so we're fast forward 100 years later, and sure enough, we are feeling the health impacts of climate change. And that's kind of where we're rooted. We're in the game. APHA serves our members who are public health practitioners, nurses, academics, students, sometimes even in the public schooling system, and so on and so forth. And we realize that the issue is so intersectional, and there's an absolute need and a voice for the health professionals to get involved. And so we stood up about 2 years ago, the Center for Climate Health and Equity, which is shifting from the conversation that, health is being impacted by climate change and it's being accelerated through human activity into action. So what can we do about it? What can health professionals, whether you're public health or healthcare, do something to get involved? And, we're looking at this through several factors. One, we need to update the workforce on, what can you do? Where are the intersections? What role can you play in the work that you already do? Because it will impact the work that you do. Maybe not today, but definitely tomorrow. And then come up with a way that we can be more cohesive in the movement, where we can stay on message, stay on point. There's a lot of things to discuss when it comes to climate change, but what are those health messages that we need to convey in a very short and meaningful way? And then, of course, building capacity. We are seeing in the public health affiliates across the country at the state and local level a direct inverse correlation. We're seeing that public health agencies are more than ever needing to address climate and health in their jurisdictions. But we're seeing a direct decline in the capacity and capabilities to address these challenges. And it could be for a number of things like having resources and tools, having an FTE to kind of focus on these issues. It could be just understanding what could be done. A list of things, but that is a very concerning issue that we're seeing in the public health space. And so today's efforts with the Center of Climate, Health, and Equity at APHA, we're really focused on inspiring action where it can be taken. We're trying to think about action that's not just to promote health and well-being, but that's equitable and just. And so all of our efforts are rooted in climate justice, but also environmental justice, environmental racism, and really looking at health equity in a way that brings the bar up for our country, for our, I guess, our global family as well when it comes to addressing climate and health.
And thank you very much, Shirley. And again, I'm Eugenia Gibbons with Healthcare Without Harm. And so much of what you just said really resonates with the work that I do, with me about the work that I do and that my organization is leading. So for those who may not be familiar, Healthcare Without Harm is an international nonprofit organization that works to transform the healthcare sector so that it reduces its environmental footprint, becomes a community anchor for sustainability and resilience, and is also a leader in the global movement for environmental health and justice. And Healthcare Without Harm actually domestically has a network of over 1,200 hospitals in the US, and we convene a Healthcare Climate Council, which consists of a number of leading systems that are demonstrating through their actions how to achieve sustainability and climate resilience. The question as to, how does this theme or the theme of today's discussion really fit in with the work that we do, I think is so prevalent at this moment, because from where I'm sitting, healthcare as a sector and hospital systems in particular really sit at the epicenter of the collective trauma of climate change, of the COVID-19 pandemic, and of racial injustice. And as a sector that has a healing mission and a mandate to do no harm, the onus is really on hospital systems, on the healthcare sector, and certainly on our practitioners and providers to really act in a way and demonstrate through action the need to prioritize community resilience, facility resilience, but more than anything, equitable access to the things that are going to make us safe. We've seen through COVID-19 that the communities who have been most effective and most decimated by the virus are low-income communities and communities of color. And these are the same communities that are most vulnerable to the effects of climate change. And they're most vulnerable to other health impacts tied to pollution, poor air quality. I mean, I think certainly folks in the audience are aware of the way that the virus has underscored the connection between exposure and prolonged exposure to poor air quality and significantly harmed and diminished health outcomes. So I don't think that in this moment in time in particular, we are capable of even entertaining the thought any longer that we can somehow address the climate crisis or address the health crisis without rooting that work in equity, in health equity, and anchoring it in social justice and climate and health justice. All of these things are so deeply intertwined, it's impossible to solve one or even attempt to begin to solve one without solving the other. And so that's the perspective that Healthcare Without Harm is really working from. We're really working with hospital systems and relying on practitioners who are seeing daily the effects of all of these things on the people that they're serving. And we're trying to leverage that experience, leverage the economic impacts and influence of large health systems to try to bring about change at a much faster pace and making sure that that change is achieving multiple goals.
Thank you, Eugenia. Adam, your thoughts?
So I will just hopefully add to the points that were just made, which I've had the benefit of really having some great opening remarks. And so just to add to the remarks already made, I will just say that I represent a very diverse and a very large community of scientists, not only at MIT, but also just in the community at large, who try to come together and not just think about this as a climate-related risk issue. My background is, as you can probably imagine, is very much in the sciences. And a lot of my education, a lot of my research up until I came to MIT were really focused on science, which is very important. But I have spent the majority of my career at MIT and at my particular laboratory, the Joint Program on the Science and Policy of Global Change, for the very reasons already stated, but are worth reiterating, which is this is a human climate issue. And to really get at not only identifying what the climate-related risks are, but to also identify how they impact the human system and what we can actually do that not only act to mitigate climate risks, but to also address human health and well-being risks. This is research that has to be brought together in an interdisciplinary and in a very vibrant and equitable research community. What do I mean by that? Well, just to give you an example. So we exercise models that, again, as you can imagine, represent the Earth system, all the natural processes. We live in an environment where we breathe air, and that air actually acts to give us an environment that's comfortable in terms of temperature, humidity, the water that we need, the land resources to grow our food. That environment is an air that we live in and breathe in. We emit gases that not only contribute to a climate problem, which is to add heat to the environment, and that heat can bring out many sorts of impacts, not only increased temperature, stronger storms. It could also impact the ability of the air to hold water, which actually contributes to droughts. All of the extremes that we find are going to threaten and impact our environment are caused by those emissions. But those emissions also impact the quality of our air and what we breathe. That has no relevance to the points made before in terms of your income levels, in terms of whether you're a minority. We are all impacted equally. And so for our research to address those issues in an equitable fashion, we need models that are able to describe those systems in the detail that we need to. We look at the impacts on developing countries. We look at impacts in developing countries. We look at the interactions of what do developing countries need to do that are equitable and fair to developing countries. We run models that look at the demographics, the breakdown of the demographics in terms of these impacts. How can we think about strategies that are, again, fair and address a lot of the vulnerabilities that the previous two speakers mentioned, which are low income, minorities, and also even climate migrants, people who do not have a stable residential environment and are continually at the whim of environmental changes. All of these have to be put into a research framework that include all of that. And the only way to bring in that knowledge is to have a group of scientists that have experienced those environments and live in those environments and have observed those environments. So for any sort of an equitable research framework to be implemented, you have to bring in those experts that have that knowledge. And particularly for this discussion today, one of the facets that we find very compelling, and we have partnered with Biogen to do this, is probably, I'm sure you're all familiar with the IPCC assessment reports, the Intergovernmental Panel on Climate Change. Now, that has been an absolutely just an incredible volume of effort to look at the climate change problem. And one of the additional venues that have been born out of that in terms of the research is what's known as the Sustainable Development Goals. Now, the Sustainable Development Goals is a much broader international effort to look at, again, these broader issues of sustainability and equity in this global change. And to date, the Sustainable Development Goals has come up with a large portfolio of targets, of metrics. And for reasons that we could probably get into in our discussion, they have been largely compartmentalized. So climate is one of them. There are a number of other, and health is one of them as well. But again, these metrics have largely been developed in not in a complementary and interactive fashion. We find that to be one of the most compelling issues moving forward, at least in our research, which is we have a lot of strategies that can match or meet any sort of climate target goals. You've probably heard about the Paris Accord, the Paris Agreements. You've probably heard about things like the 2-degree warming target or the 1.5-degree warming target. We have a lot of strategies and a lot of scenarios that can give us the greatest possibility, the greatest probability or risk you could even think of achieving those goals by the end of the century. What they don't do, and what we think is very important, is they don't necessarily guarantee human health and human well-being. And that is where we find our research to be sort of at the forefront of looking to ways where we can enhance our research, enhance our models, bring in the necessary research staff to look at how can we look at these climate target goals and further identify pathways that assure human health. There are a number of ways we can look at that. One is just simply air quality. So we make certain decisions about what sort of technologies we would implement to reduce emissions of gases that we know affect, again, the climate problem, the energy problem, the energy balance problem of the climate system. But as it turns out, some of those decisions that you make about these technologies do have health consequences. And they may actually have health consequences based on where you deploy these technologies, where these technologies are being used to produce new energy resources that they themselves are emitting and affect the local environment in adverse ways or ways that have unintended consequences. We don't want those unintended consequences. We would like to avoid those. So a lot of our research to date, and again, with this new partnership, we are very excited to take a real chunk out of and make a real advance in combining these climate and health targets in a very seamless and a very homogenized way.
Great. Well, thank you so much, Adam. Very exciting and interesting work. And let's go to Monica. Monica, can you give us a bit of context with your work as well?
Yes, I started to earlier. I was getting a little excited and jumping ahead here. But as I mentioned, I'm with Blue Cross Blue Shield of Massachusetts. We are a tax-paying, non-for-profit health insurer. What in the world is health insurance doing in environmental health, right? First off, I know it's not a sexy industry for a lot of people who think about work and impact. But for us, we view our environmental program as one of the many strategies that we're launching in order to ensure and support population and public health. We're not going to address the opiate epidemic. We have a team doing that. We're not going to be addressing mental health, although it is interconnected and related. And we're absolutely not going to be supporting and addressing death with dignity. But there's a shared philosophy across our organization that with healthy environments, we have healthy communities and healthy people. And so earlier I'd mentioned, I partner with various division and department leaders to ensure that these principles are linked to how we design and construct, how we operate, how we purchase. We're looking at our core investments and retirement, and also thinking about new product development, new ways that we can connect with our members. The breakdown of our work really is both internally and externally focused. And as Adam and Shirley and Eugenia have all mentioned, there are these impacts that our work can have. And so we also are seeking, to better understand those unintended consequences. And so there are a lot of different ways that we have created structure to the program to try to take in all perspectives to ensure that it's both positive for health and positive for the environment. So for the first thing is that our work is rooted in the Sustainable Development Goals, those which are more relevant and pertinent to us as a health insurer. And for people who aren't familiar, that's basically the 4th iteration of the United Nations human rights. I mean, it all comes down to we all deserve access to clean air, clean water, secure home, and food. And so the internal and external focus are thinking about if we need to power our facilities as an administrative site, we're going to need energy. So one example is investing in community solar. We are sourcing a renewable source, bringing it into our facility. The community solar relationship allows other communities in Massachusetts access who otherwise wouldn't have access to renewable energy. We're removing, by sourcing renewable energy, we're not contributing to air pollution, which is increasing those asthma rates, premature births, bronchitis, you name it. And at the same time, we're also able to save money. And that's just one of the many different strategies. I could talk about chemicals and food and environment, but I'll save that for later in the conversation. Thank you.
Great, thank you so much. Each of you touched on so many reasons why both climate and health and also equity matter to Biogen as well. We recently announced a 20-year, $250 million commitment on an initiative called Healthy Climate, Healthy Lives. And with that, we became the first Fortune 500 company to commit to going fossil fuel free. It's amazing. And it's a reason we chose the target is not only to address the climate change, but also human health. And Adam, you touched on this a bit. I've gotten a lot of questions about the connectivity between climate and human health. And at Biogen, our tagline is where science meets humanity. So Adam, can you just tell us a bit about the connection? Like, how do you see that connection between climate and human health?
Sure, Stephanie. Again, I speak for a lot of my colleagues in a lot of the work that I've done. And in terms of climate-related health risks, I'll try to be brief. So at the very first order level, again, I go back to this very fundamental fact that what we do in terms of directly impacting the climate system is that we add heat. We emit gases in our environment, and it is those gases, not all of them, but some of the gases, which are very important, affect the amount of heat that the sun falls, well, the sunlight that the earth intercepts, and the earth traps that energy within the atmosphere. And again, gives us the environment that we have. And it's that just basic energy exchange. The energy coming from the sun, it strikes the earth, and the earth capturing that heat, which directly impacts the temperature of our environment. And just by doing some very simple extrapolations, it's that additional heat that leads to increased temperature. And in many cases, and in many parts of the globe, it leads to occurrences of very, very high heat stress conditions to the human body. And this is not just in the form of to the temperature itself, There's a very important relationship between the temperature of the air and the amount of moisture that the air can hold. So not only as it gets warmer do we feel the heat, but as I'm sure all of you have experienced yourself, you go to a hot, humid environment, it doesn't take a lot more of a temperature increase to make you feel really uncomfortable and to really affect your health. And so it is that contribution, that combination where we are finding, again, going back to this issue of equity, we're finding that places in the world that are primarily low income and developing nations, we're finding that these locations are the locations where the combination of these two increases are their largest. And they will lead to, in a more rapid sense, in a more rapid rate of increased sense, these are areas where the environment will simply just not be not only comfortable, I mean, we're not even talking about comfortable, we're talking about crossing thresholds that actually have a direct impact on human health. So the question is what can we do about it? There are mitigation efforts, but the real challenge here is that there is this issue of unavoidable change. It does not matter what we do and how fast we do it. The climate system does not turn on a dime, and it does not stop on a dime. It takes a long time for these adjustments to be seen. So what we do now, and not only what we do now, but what we decide to do over the next course of the next few decades, which are going to be critical, we're actually not going to see those benefits until the middle of the century. And so we have to think about adaptation methods, adaptation actions now, and at a global scale. So I just talked about temperature. You can even carry that forward to the quality of our air. We've already talked about this before. The decisions that we make about the technologies that we use for energy. Just to give you an example, Monica gave a great example about what we can do locally to affect our environment, which is change to solar. Now, the challenge here is those solar cells have to be manufactured somewhere. And so the decisions that you make about where they're manufactured to meet the global demand, we have to talk about global deployment, where those have to be manufactured, and then where they have to be subsequently shipped and deployed have real consequences.
Yeah, it's amazing.
It's incredible. So I could go on and on. I'm not going to.
Oh no, I was just going to follow up because I think you're talking about sort of real tangible targets there. And for example, Biogen's been carbon neutral since 2014, and many people say, what does that mean when you're thinking about sort of offsetting the amount of carbon dioxide that we would release? And then we have an aim and a goal to be fossil fuel free, say that, by 2040. So when you're talking to the audience about targets and what we have to do now to prepare for the future, are there clear targets that we have to think about from a global perspective? And are there clear targets that our audience can focus on to help them take into account sort of this human health nature?
So I think the global targets are really useful for international negotiations, for nations talking to nations to talk about what steps can we take to solve this global issue. It does become, to your point, Stephanie, incredibly complex when it gets down. I mean, the devil is really in the details. And so locally, there is always something that everyone can do individually to make a very sort of small contribution to this global problem. And people have to think about it in terms of that scale, or at least that sort of aggregation of scale. If everybody in the world did one small thing, and they might think just to themselves, gosh, this just seems pointless or useless. Well, think about 7 billion people doing it, right? It then becomes very useful. It becomes a real important contribution to the problem. The larger macro scale issue is, how do global industries and nations provide that infrastructure, that supply chain to hopefully avoid these unintended consequences I've talked about. And I could get into the real details about what specifically. I mean, you can think about this. think about biomass production, right? Biomass production, it gets at the heart of, I think, what is a really important issue of the carbon issue, which is there are a lot of technologies out there that are being promoted to artificially take carbon dioxide out of the atmosphere and put it into the ground, essentially. We have a natural resource, nature-based solutions that do that more efficiently than any technology, which are trees, plants, right? So that's really what's behind biomass technologies, is to literally take a natural resource that does what we want to do, which is to take carbon dioxide out of the air, fix it into the soil, but also provide an energy resource. Now, the trick here is that the fuels that are developed, while they are carbon neutral and can actually be carbon fixing, the emissions that they produce, while climate friendly, aren't necessarily air quality or air health friendly. So we have to be very careful about how we deploy that to scale, and how the decisions that we make about what technologies we use to provide the fuel in terms of biomass. The decisions that we make about how we burn that can affect human health.
Absolutely. Oh, and speaking of human, yes. Oh, so go for it, Eugenia. I'm sorry.
I'm sorry. I wanted to jump in for a moment because I think Adam has raised a couple of important questions. I think the most important thing, just to get back to the initial question of sort of what is the interaction between human health and climate, yes, technology choices are absolutely important and we need to think about them. But I do think it's really important to recognize that what we are dealing with in terms of climate and health is not a futuristic scenario. So the idea that we would not realize benefits until mid-century, while somewhat true, is not where we as advocates kind of focus our efforts, because we're seeing the impacts of climate change and public health collide today. So, we had a very hot summer this past summer. It was one of the hottest of record, and extreme heat on its own is very deadly. Extreme heat combined with a pandemic is devastating. And the folks for whom that is most devastating are the people who are living in communities that have been exposed to toxic pollution, whether that's air pollution, environmental pollution, water pollution, discriminatory housing practices, the siting of transportation and transit nodes, all of these things. We have a long history of bad policy that has contributed to marginalization of communities who are left most vulnerable to the health and economic and, whatever effects you want to cite of climate change. And I think that is, really where the conversation around climate health and equity and where these things intersect needs to return, because indeed we do need to be thinking about clean resources, for example, to meet energy needs. But we need to be thinking about who has access to those resources and what are we doing to take steps to accelerate adoption of clean resources so that we are leapfrogging the fossil fuel combustion-based technologies that are the very things that have gotten us into this situation to begin with, and that will only exacerbate the problem going forward. So for example, if we're thinking about something that is very near and dear to my heart and to my advocacy work is around indoor air quality and home health and safety. And if we're thinking about the type of air that a person is breathing in when they're in their home, if that home is not a highly efficient home, or it's not the air quality is poor in that home, and then we're installing a fossil fuel burning heating or cooling system to keep to achieve comfort, cooling or heating, we are contributing to poor indoor air quality. And if we are working in this moment with trying to think through how we reach those science-based targets for a transition off fossil fuel, then the answer can't be, well, we're gonna still rely on a more efficient fossil fuel system right now. We have the technology available to us at this moment to leapfrog the dirty resource and put something cleaner into a home. And we know, without any real need to do more in-depth analysis where those homes are. We know
Right.
whose houses are inefficient. We know whose houses lack good quality indoor air. We know whose homes need these things now and the barriers that they're facing to getting them. And so I think the role of practitioners and certainly of the healthcare sector and others in connecting these dots is critically important, because not only are we able to point to examples of why this needs to be prioritized today and why access needs to be made available today, we can also tell a very compelling health story related to the benefits of making those investments. And those benefits are quantifiable and they have a value, and perhaps they should be monetized. And the last thing I'll say, because you did mention Biogen's very impressive announcement a couple of weeks ago. I think what's so outstanding about that announcement and why I hope that others will follow is because it is a science-based target, as you noted.
Yes.
It does in fact touch, energy generation and the energy mix that's being consumed by the company. But it's also being implemented from within every level of the organization, from top to bottom, and will eventually touch upon other things like investments, as you noted, and supply chain. And so that is where we're seeing, that's an excellent example of a large entity leveraging its purchasing power, leveraging its economic capital, and basically drawing a line in the sand and saying, we're going to take this and we're going to start making this shift. And you either need to come with us or be left behind. And that's what it's going to take to make these things more common and make these technologies more accessible and make these solutions implementable today as opposed to 10 years from now or 20 years from now, when quite frankly, it's going to be far too late for most of the folks who are living in the danger zone of climate change.
Yeah, and it takes me back to what you said earlier, Eugenia, with your mandate of do no harm. I just thought that was so apropos because it really holds us all accountable for today and what we're doing now. I want to shift just a bit, but related to that, I think what you just reiterated is the fact that we are facing big challenges with health and climate, and then the intersection of both. But we know that everyone isn't impacted the same. And so when we think about the impacts on communities of color and those that are disproportionately impacted, Sootario, I'm just going to ask you, what do you think about that intersection between health equity and climate justice? Can you talk a bit about that? I think that would really relate to Eugenia's point she was just making.
Yes, and I was snapping the whole time. I mean, you hit on so many things that I can just jump to other points. But there is a science in repeating, right? And so people hear it and it sinks in. And the thing that I want to repeat that several of us have said is that climate change is here. It's impacting us today, our health particularly. And there are things we can do about it. We just need, political will, money, resources, blah. Okay. In terms of the intersection of climate and health equity, climate justice, I just, I hate saying this, but I find myself saying it so often, which is climate change will impact us all. The difference is some of us will be able to bounce back from those climate events and some not. And it's so important when we're talking about building resiliency, which has turned into a buzzword, that we're not just building back to where we were before, because as several of us have noted, climate events are going to worsen. They're going to become more frequent. And so we need to build back communities that are stronger and more resilient to the oncoming climate events. And so that's where the rubber meets the road, where we really need to focus on closing that gap that's widening right now because of systemic racism, because of the pandemic, because of climate events. We need to find ways where we can build that resiliency that closes that gap for achieving health. So when we're talking about populations, we're not just talking about communities of low income, right? There are climate sensitive populations like the disabled pregnant people, children and elderly in particular. Then we have migrants, climate migrants were brought up, and any and all folks that have been marginalized for one reason or another, including indigenous and tribal populations. So when we're talking about climate justice, we're talking about human rights, right? We're talking about rights, period. So I like to look at about this through the lens of adaptation. And so when we're talking about health equity and adaptation, we're really focusing on that 20-80 split. 20% of what it takes for us as human beings to achieve good health comes from a doctor's office, a prescription, etc. The other 80% of what it takes to achieve good health comes from structural and social determinants. And this is back to the social determinants. It's our access to transportation, so then we can go to the doctor's office or get good food, access to safe, nutritious, affordable food, our housing quality. We've talked about outdoor air and climate, but there's also a lot of indoor air quality issues that climate can accelerate. And we're talking about having an income that we can survive off of, not just employment. Employment is a huge determinant of health, but having a job so you're not carrying on 4 or 5 jobs to make ends meet. All of these things impact our ability to build resiliency in communities. So how do we focus on taking these almost existential, big, life-threatening challenges like wildfire smoke and evacuation and transportation challenges and the need to earn an income? So how do you do that? We need to have systems and place-based measures where we're looking at not just the health of people, but health of the community that's being affected the most, and helping those communities build back that capital, build back that status in a way that's meaningful, in a way that addresses not just the immediate health impact of climate change, but also the other surrounding determinants that can then help them continue that resiliency. So it's not just building the resilience, it's maintaining resiliency. So we're really looking across the field to make sure that we're working cross-sectorally. And by that, I mean just outside of health, we're working with transportation engineers, we're working with planners, we're working with housing individuals, education, and so on and so forth. And it's so critical. I think I mentioned the word intersectionality of the issue of climate change. And it doesn't go without saying that is a big component on how we can achieve and close this gap in terms of health equity.
Thanks so much. It reminds me and takes me to Monica and her work with Blue Cross and Blue Shield, because we're talking about sort of practical issues of access to clean air, to clean water, transportation, as you stated. And I recently learned that, if the world eliminated fossil fuel emissions, that the average life expectancy around the world would increase by a year. So, I mean, just think about, that's 1 year possibility for every single person that each of us knows. I mean, it's profound when we think about it. So Monica, how is Blue Cross Blue Shield thinking about this? I mean, how are you guys approaching the social determinants of health in both equity and climate? I think you guys are unique in your positioning.
Yeah, thank you. So I don't want to take it for granted and assume that everybody knows what the social determinants of health. So I'm just going to quickly share CDC definition, but it's essentially the conditions in the places where people live, learn, work, and play, which affect a wide range of health risks and outcomes. And so at our organization, we have dedicated to using our economic influence to address these social determinants that impact health by how we build, in which communities, what materials we use, thinking about the long-term effects and hopefully not, but any unintended consequences in the communities in which we're operating in and how we operate. And I gave the example of community solar earlier. How and who we're hiring and investing in our communities, especially the local, the diverse, and the underserved. There are a lot of different ways that people can look at the social determinants of health. Sootario earlier had introduced 2080. There are different percentages that different organizations and groups are looking at, but the way that we have segmented our support is really community. What can a community do to address it, and what does the individual have to do to address it? And how can we make an impact in both areas so that it is positive in both? So we have a foundation who is really addressing access to quality care. First off, the social determinants of health is getting access to quality care to begin with. And so we are addressing lower income, uninsured populations and ensuring that they have access, they know where to go, medical literacy, you name it. And then from individual impact, there are certain things that people have access to, but otherwise might not understand what some of those changes are that they can make in their lives. So we are leading what we call a prescription program. The very first one is called .rx, representing the Dorchester neighborhood here in Boston. We're working out of a community health center and with various physicians and other collaborating organizations in trying to address those individual impacts. How do we help them get access to being healthy and physical, get access to the outdoors and start to introduce environmentalism? Some physicians will write prescription for the outdoors and they'll go and they'll meet with the Appalachian Mountain Club. There will be nutritious and healthy eating, so focus on cooking classes. We support by subsidizing gym memberships. And so there are a wide range of activities to help people think about those individual behavior changes that they can begin to make and fostering and growing that program. And then there's community impact. What do we do? What can we do as an organization by how we operate, where we work and whatnot? And there are a lot of different things in that we're doing from a community perspective. It comes to the materials that we're selecting within our facilities, ensuring that the end of life, it doesn't end up in landfills. When you think about some of the waste incinerators in the state of Massachusetts and the communities that they operate in, they're highly polluted. Earlier, I gave the example of energy. You know, here in Massachusetts, we celebrate and being really progressive and focusing on renewable energy. And, you know, there was a big argument as to, you know, why we couldn't look at offshore wind off the coast of Nantucket. I'm not going to get into this population, but people were talking that it would create just sort of this monstrosity off in the horizon. They wouldn't have a great view. And at the end of the day, we succeeded and we're moving forward with wind. And we're hoping to eventually source more renewable energy. But the truth is that we still, for the population which we had to rely on fossil fuels and growing that infrastructure. And that happened in some of our poorest neighborhoods. Those neighborhoods which Eugenia had made that really clear and distinct connection that were already suffering, and our neighborhoods of Chelsea and East Boston, who were most grossly impacted by COVID, not for a lot of reasons. And so we recognize it really comes down also not to just what we do, but this collaboration that we have with other NGOs and outside organizations. It comes to supporting good policy and ensuring that the policy is there to drive the right way of life. And it comes down to actions that we take and the engagement that we have, both with our associate population, with the collaborating partners, and hopefully soon our members, our accounts and members. And going back to, you know, those founding principles and the work that we do, how do we protect our food and watersheds and the air basins in which we're breathing? Thank you.
Great, thank you so much. If those in the audience have questions, feel free to include them in the Q&A portion. I have a couple of open questions, and so this is for any of you all. And I think both Eugenia and Cyril spoke about the call to action and the need for others, even outside of the healthcare sector, to just get involved in climate and equity and sort of social justice issues. So with everything going on today, like think about all the issues we're facing as a scatter diagram. What do you guys do, and what are your strategies and your thoughts to get individuals really focused in on what we need to do for a healthy climate and healthy lives? Any suggestions or any strategies that any of you guys are employing?
I just want to make sure.
Go ahead.
Go ahead, Eugenia. No, you should go.
Oh, that's a good question, because this can absolutely be daunting and overwhelming at times. I think there are personal choices that people can and should make when possible, that have to do, if you're able to select a clean, non-emitting energy source. In Massachusetts, we have the ability to participate in a voluntary green power program. And so you can sign up to get 100% renewable energy to power your home or your business. You should do that. If you're able to, utilize some mode of transportation that's not a fossil fuel powered vehicle, you should do that. If you have the ability to do those things, you should walk more, you should bike more. You can engage locally in your community to plug into the work that local organizations are doing. Maybe they're trying to restore green space to the community. Maybe they're trying to work to connect the dots for people and help them realize what their role is in. But that's where I say, as an individual, there are definitely individual choices you can make. And also, you can always support the good, hard advocacy of the community-based organizations that are doing the work as well. And then from a policy perspective, I think if you are in a position of power or influence and you're able to have these conversations with decision makers on a regular basis, then you should be saying repeatedly, as Shirley said, you have to repeat it. We need to be focusing on science-based targets. We need to be thinking about how to leverage our own capital to achieve these goals. We need to be political capital and financial. We need to be thinking about people-centered approaches to achieving those science-based targets. So it cannot strictly be greenhouse gas emission reductions. It needs to be all of the other things. How is it people-led? Are we deferring to folks on the ground? Are we moving in a direction that keeps communities, I love what you said, Shirley, that keeps communities and people healthy and whole? Are we balancing all of these goals? It's hard to sometimes think about needing to meet an urgent and immediate need and also keep in mind that we're moving towards a long-term objective. So how are we doing that? And then the last thing is always, it really should be the first thing, the work needs to be anchored in equity and in justice. And that means that that's going to require that we value some of the things we don't value right now, the co-benefits of climate action, the impacts on health, the failure to act, and the costs associated with inaction. Those are measurable in lives lost, real lives lost, mostly brown and black lives that will be lost prematurely to pollution. And then collect the data and use that data to assess progress and make changes. And so that's where I begin and sort of end the conversations with my policy and advocacy hat on. Others, I'm sure, have other thoughts.
If I could just jump in, Eugenia, because I think a lot of your points, again, benefiting from great points here. And I think just to add to those, one is I just want to reiterate the points that you'd made too about actions at the local scale, the personal scale. One of the big contributions that can be made now, and you're probably hearing this more and more, is data. The research community needs data at the granular, at the level that you're talking about, Eugenia, at the actions that people make. We need that data. People can collect that data, log that data, start engaging in the scientific process. And beginning to understand how the scientific process works, it's going to go such a long way with this culture that seems to be somehow gaining traction, that somehow we all have to just question science, or that we should be skeptical of what science is telling us. I would love to see people at a personal level get engaged in the scientific process to really begin to understand what we do. So I thumbs up to you, Eugenia, on those comments. One thing I would like to add, and it goes back to the comments made about what people could do at a very personal level to contribute to this very global problem. And I know a lot of attention gets put on recycling, but I would like to put a pitch into this issue of waste. and in particular, food waste and composting. There's a very eyebrow-raising statistic that says something to the effect of our topsoil, so the layer of the soil that we rely on to grow the food that we eat, but also that soil is very important in terms of regulating the air, the quality of the air in our environment. That topsoil globally is going to disappear within about 50 years if we don't start doing something, not only at a personal level, but at a global scale level in terms of agriculture. So composting, reduce food waste. Any food that you do not consume, compost it. Find ways of getting it to community collection centers that use that compost to then bring it back to the farms and improve the topsoil. Soil health is human health, it's food health, it's air health. It's something that you can do at a personal level, and if we do that at an aggregate scale, if everybody does it, it's going to make a huge contribution to not only climate, but health.
Great, thanks, Adam. I love the idea of everyone sort of thinking holistically about our lives. So really, I wanted you to weigh in here as well. And also, one aspect that we haven't discussed, if you can just include it in your response, is the impact on mental health. And so what about climate change and mental health? If you can add that on to your response as well.
Sure, happy to. You know, well said, both Eugenia and Adam. So I'm not going to add too much to what you said, but it just strikes me that it's such a, you know, both and approach. So we need policies, broad sweeping policies at the national and global levels to improve action to that reduce our climate footprint, but also individual action, because we're on it together. There's several individual actions. And I love that Adam pointed to one that's very tangible, like composting. What I would say is that it would be so important for us to consider that request of individuals is also paired with policies, right? And by that, I mean local policies that enable choices by individuals to be accessible, affordable, and easy. So if you're going to ask people to compost, let's give them information on how to do it. Let's not charge extra in addition to trash collection and recycling. Let's not charge additional cost for people to put out compost for it to be collected. Let's make it easy and accessible so we can all participate in it, not just those who have privilege and power and money and time, et cetera. But in terms of mental health, I feel like this is a conversation I've been a part of since April when it comes to climate and health. So there's a lot of ways climate change is impacting not just us physically, but psychosocially as well. And I say psychosocial because it's not just causing mental health harm, but also taking away our ability to maintain spirituality or mental wellness. I see three different types of mental health effects. One is the immediate. So take wildfires. That's, you know, top of mind right now for me. We're seeing wildfires. People are faced with immediate danger, which causes anxiety, even post-traumatic stress disorder in some cases. And then you're seeing more of the gradual impacts. So we're seeing sea level rise in coastal towns and what that means, that anxiety, like, am I going to get flooded? It's raining. Is that like that constant perpetual causing chronic stress that we now know through medicine? If we're living with a lot of chronic stress, it impacts our other systems. It impacts our organs and our health, our cardiovascular health, our renal health, it just goes on and on. And then we're seeing the indirect impacts. So again, back to wildfires and hurricanes, if you will, displacement is one that's huge. We're not able to go back to our homes because they were damaged, or we need to leave. Those are big problems. And it may not seem like it, but the sense of a community, or having community, knowing your neighbors, having your family down the street from you, that sense of community is really rooted in your identity, in your sense of self. And so we're seeing more and more people losing their sense of self. And how do you reestablish that community? And I can't talk about mental health without also mentioning the other pandemics that are going on, right? So we're in a syndemic is how I like to talk about it, with all that's happening with the movement for Black lives. That is an additional added chronic stress level for a lot of Americans today. You take COVID, you can't, if you're really struggling to evacuate and you don't have those other systems in place like transportation or access to healthcare, how are you expected to evacuate and establish your new identity, your new community in a new place when you're still trying to survive on a basic level? And then add COVID precautions. How do you go in a high heat day to a cooling center, knowing that there's going to be other random people there that are also seeking reprieve from the heat, that may or may not be infected or asymptomatic? And that's a thing, in case anybody was wondering, to also carry, the disease. So mental health is something that we absolutely need to focus on. It's not just a conversation we should bring up after a mass shooting. It's something that we need to realize that in order to be whole as a person, as a community, we need to recognize mental health in terms of individual, in terms of community, but also in terms of the policies that we put in place, because we need to address this head on.
Great, thank you so much. Monica, I wanted to ask you, there's an increased emphasis on employers and employees. And at Biogen, with our Healthy Climate, Healthy Lives initiative, as an employee, I have a role as well, but Biogen has offered resources and toolkits and incentives. What have you guys done? Are there any unique, I would say, incentives or any unique challenges, or how are you engaging your employees with respect to this initiative?
Yeah, thank you. So there are a lot of ways in which we are informing and engaging with our colleagues, as well as our accounts and now our members. I think early on it started out with employee resource groups, green teams, to get the word out and to leverage campaigns to help inform our colleagues about what the issues were at hand and what is it that we're doing as an organization and what they can do internally. Over time, that has evolved, and that this past January, we launched an app that our entire company uses, and we're piloting with a couple of accounts, that integrates sustainability as a health challenge and objective alongside and equally weighted against, for example, smoking cessation, weight reduction, healthy and nutritious eating, sleeping. And the way that our program is set up is we incent our colleagues in rewarding them. So we're not prescriptive about what it is that we ask them to do. We have them self-select their own health journey and what it is that they would like to focus on. So they can select from a myriad of challenges and goals on a quarterly basis, including environmentalism. And every time they complete it, they are awarded points, which is translated into money. At the end of the year, we will pay out up to $600 a year for somebody to be healthier, which includes those environmental activities. And we view being healthy and incenting and rewarding people for being healthy as better than having to think about the intervention on the back end and treating health illness. So that's one of the ways. We also have for our accounts what we call a culture of health toolkit. It's an assessment that we introduce to our accounts and invite them to participate to help them understand their health journey. And everything is taken into consideration from the buildings in which we operate in. I can't remember, I think it was Sorelli who had mentioned, I'm looking at my notes here, indoor quality and air. We absolutely agree and understand with the Harvard study that improved air quality improves cognitive development, cognitive function. And so we're looking at the building and the environment. What are some of the healthier, safer ways and strategies that they can implement down to how they operate, and what are the services they offer their employees, which would be our members. And at the end of the day, this culture of health toolkit is segmented into various modules. And there's a sustainability module. A sustainability module, which we believe is best in practice, and we are working on that journey ourselves in some ways, in addressing some of those critical areas and topics that we need to focus on, from carbon to chemicals of concern to the food in which we're eating, and different behavior changes that employees can make. We also, in terms of engaging with our associates, are the premier sponsors of a local rideshare program here called Blue Bikes. And we are not only using Blue Bikes to introduce healthy and active lifestyles, but if you go on your app and if you go on your own individual site, it tells you how many carbon emissions were avoided. And we're introducing the information internally with how we're leveraging Blue Bikes to be a sustainable form of transportation, plus expanding it into communities who didn't otherwise have access to rideshare programs, and advocating for safe bike lanes across the city. But so yeah, and then the last thing I would just quickly add with regard to science. I think Adam mentioned something about getting people engaged in science. We recently collaborated on a grant with the Silent Spring Institute and the NIH in polling our employees on how they would like to receive information about endocrine disrupting chemicals. I think it helps us all understand, if we know how people want to receive information, then we can put information out there that's going to be used. We're not just pushing it. We're putting the information out there in a manner that's going to be useful to an individual to make changes, healthier, safer changes in their lives. Thank you.
Great, thank you. And we just have a few more minutes. We're going to make sure we get everyone out on time. So I'd just like to do a quick fire round for each of my panelists to give a closing quick thought. And I'll go first. I would say from a Biogen perspective, climate, health, and equity, they're deeply interrelated, and the challenges require bold action, and Biogen is willing and has stepped up to the plate with our Healthy Climate, Healthy Lives. So that's my quick summary. Let's go, Cirilli. What are your thoughts, your closing thoughts?
Sure. You know, in public health, we often say that we're the first generation to feel the health impacts of climate change and possibly the last to do anything about it. So I would just encourage everyone to do as much as they can and get out there and vote. Vote for health, vote for climate. It's a big year.
Thank you. Adam.
I couldn't agree more about get out there and vote. That is just so important now more than ever. I'll just say that just in this past hour talking to these fellow panelists, we have a pretty awesome team here. We should think about moving forward collectively in all aspects. You know, again, I represent probably more of the academic community, but the work that Monica, Cirilli, Eugenia, you're doing, it would be great to think about teaming up. This would be this would be a dream team.
Great, thank you, Adam. Eugenia.
Yeah, in addition to everything that's said, I think, you know, we absolutely have to apply the hard lessons that we have been taught throughout the last 8 months of this pandemic, which seems like an eternity, and just really be proactive in the way that we pursue climate justice as part of climate change action. There's just simply no addressing one without the other, as I said in the beginning. And we can't address either of them without also addressing health and environmental disparities, especially for our most vulnerable communities and communities of color. But we can do it. We have the ability, we have the wherewithal, we have the technology. And if we do, then we will truly achieve resilient healthcare systems, resilient communities, healthy and resilient thriving, a healthy and resilient, thriving country. And so vote, remember those things, anchor the work in justice. And thank you so much. This was wonderful to be part of.
Thank you. And Monica, closing thoughts?
Closing thoughts. Well, I feel like I echo everything that you all shared. I would say we all share these sentiments. And I think at the end of the day, I just want to also add that our successes are not just because we made the decision to do this and then it was easy. Our successes are due to industry evolution and having access to more healthier, safer products or energy. Our successes are due to collaborating organizations and helping us understand science and identify what are some of the drivers and changes that we can make based on who we are as an organization. Our successes are based on policy change, policy which reflects a world in which we are evolving and becoming, which is helping to open doors, protect communities. And anyway, I just want to end that I'm very inspired and encouraged, and I agree with Adam. You know, collaborating with y'all would be amazing, and thank you.
Great. Thank you, guys. We're right on time. Remember, this will be available for replay, and thank everyone. Thank you so much. Your Q's and A's, those have asked questions, have been responded to within the chat, and I've asked some of them live. Thank you. Thank you, guys. I really appreciate it.
Great job today. Thank you, Stephanie.
Bye-bye.
Bye-bye.
Have a great one.